you like that. Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Nothing.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Shavani Nisbet, Senior Health Educator at the Health Promotion Unit. With me, I have two guests. One of them you may be familiar with as our very own Chef Michael Henville. And today we are not speaking about food, as we usually do when Michael is involved, or cooking, but we're speaking about something different. So I'll let both of them introduce themselves, and then we'll speak about why they're here today.
Thank you very much. Good day, folks. My name is Michael Henville, and I am the president of the Caribbean Foundation for Children. And to my left is
Jareem Encarnacion, and I'm the vice president.
And we're here to give a little bit of info about the foundation and talk about why we're here and future endeavors.
Good job. Awesome. Thank you. Welcome, gentlemen.
Thank you.
Thank you for having us.
All right, you're welcome. So tell us, what is CFC and what does the organization do?
CFC, Caribbean Foundation for Children, it started back in 2002. It was the brainchild of my younger brother Jonathan, and he just came up with the idea out of thin air and just said, let's start something that we can help people.
Okay.
That's all he said. He said, I want to help people. Let's do something. So, the family got together and said, okay, well, let's do it properly. Let's do it professionally. Let's start a foundation. We get it registered. We get it. It's a 501c3 registered company for all you tax folks out there. So it's done right. It's done properly. It's a legit foundation limited, set up in Florida back in 2002, and moved to Nevis in around 2008, 2009. Yeah, and basically it's helping all aspects of children, but with a concentration on health, concentration on education, and a concentration on community. So all of those aspects that fall under those three things that we really try to take care of with children, specifically children. Yeah.
I like that. What particular aspect of children are you looking at? Is there a target audience for the children itself?
So we look after school kids mainly. So we're talking from K through even up to first form. We partner a lot with local schools here, and even back in the States, in Florida. We've worked very closely with many of the primary schools here, and even on St. Kitts. We've worked with the Molyneux Primary School, I believe it was the Eldridge Primary School, getting them, what's that? VOJN, correct? VOJN Primary School, St. James Primary School, everything from scholarships for getting them uniforms to feeding them for the school meals program, sponsoring kids for the school meals program, all the way to supplying teachers and students with proper school gear, so book bags, books, pens, pencils, crayons, whatever they need. So it's a very, and that's basically what my brother wanted to do, just to help children, those who are a little bit less fortunate, or families who are a little bit less fortunate. We've all been through tough times. There's nothing wrong with that. Right. So that's what communities are for. That's what we are here to put on this planet for. It's just to help one another. It's really that simple.
I really like that. That is really good, and I wish more persons would actually do stuff like that for the community. So, for persons who may not know, your brother that you speak of, was he living here at one point in time? Did he grow up here? Does he have any attachment to Nevis? Why he decided to do this in Nevis?
Absolutely. He grew up here. We all did. Okay. Right over there in Newcastle. But he came down with leukemia at the age of 3, 4. And so, Nevis, back in the 80s, things were a little different back then. So we did have to leave to get him the proper treatment in the States, and that's when we moved up to the Bronx in New York to get him proper treatment for his illness. Thank goodness he made a full recovery after about 7 years of leukemia and treatment. Yes, treatment for the leukemia, and made a full recovery. And I think that's where he got motivated, yeah, and a new appreciation for, you know what, let me, you know, a lot of kids probably weren't as fortunate as he was at the time, so let me come back home and help. That's it. Let me just come back home and see what I can do to help those in need. And, you know, fast forward to 2020, and here we are, still doing it.
That is really good. Congratulations on that. And that's something that touched me, really. So seeing that you guys have been doing so much, and some of the things that you listed, helping the schools, helping the teachers, the students, etc., have you been able to like watch things like blossom? Because like you would help a child and then you see like the child is doing well and they grow up and they come back and thank you. Can you share some of that?
Sure. Yes, it's very humbling to see that. Even working with the Ministry of Health at my current position, with the chef position, I've seen kids from grade 1 who we've given school supplies to, or book bags, or sponsored them for the school meals program. And I've seen them go grade 1, grade 2, grade 3, grade 4, you know, and they come by every now and then and give me a high five or give me a hug, and you know, I'm like, oh, it brings a tear to my eye. But it's really humbling to see that, you know, it didn't take much from me. It didn't take much from the foundation, and that student will always remember the little help that they got, whether it be just a book bag filled with stuff, you know, for their schoolwork, and or they'll remember the hot meals that they ate throughout their years, and you know, that sort of stuff will always stick with them, and then hopefully that would then in turn let that student help others, and that's the key, and for it to continue and blossom and spread that way. Yeah, so it's very humbling to see that. To see that growth, you know, yeah.
And what about you, Mr. Vice President? Can you share some of have you been attached to it for a long time, and can you impart some of that?
Sure. I haven't been attached to the foundation for a very long time, but attached to it long enough to know that there have been some milestones that they have accomplished here on the island, such as the hearing impaired program, where they were giving out hearing aids, which is back in 2009, which is now a part of the ministry program. They take it over in 2016. So I am privy to some of that information and the ripple effects of those things moving forward in the community. So to dovetail what the president was saying, it is very humbling that you can see a program that was birthed out of love, you know, blossom like a lotus flower, and now you can see the results of that in the younger children, and hopefully they will infect others, you know, virally, because nowadays with the internet, that's all we're talking about, going viral. Right. Well, what we would like to see is that for the Caribbean Foundation for Children to go viral, to have that effect with the youngsters, so that they can see, okay, someone gave me a hand up. They helped me in a situation, and now I can pay back or pay it forward. So that's the goal, you know, is to have this long-lasting ripple effect throughout the community.
Yes, the stuff like that is important, because even not on such a larger scale, sometimes you would find, like, especially during graduation and sports time, if you went to a school, you could actually go and say, I want to give a certain amount of money. Correct. And they would say, this is the award for the child that improved the most over the term, or the child that has the least amount in terms of, you know, coming from a poor home and that kind of thing. Yeah. So it's like, I like stuff like that in the community. And then I could speak for myself, because I've seen other persons in my peers do that, and so it made me want to do it too. And then I see my parents do it, and because the same school I went to, my primary school, my parents went to that school. So when they give, you want to give, and then you see your friends give. Yes, right.
And
so
it makes you feel good.
It does. And especially if it's to a child that you know needed it, so even if you didn't give it, the child wouldn't have. So it's like that makes you feel so good. So I like stuff like that. I heard you said that it was turned over to the government in 2016.
Yes.
Or to the ministry. Could you tell us a little about that?
Sure. The not the foundation itself, but just the hearing aid
Okay.
aspect of it.
Yes.
2016 was when we partnered with the Starkey Foundation. I believe they're out of Minnesota, in the States. And in 2016, it was actually because it just got so big. It was
Success.
so it was such a huge success. I mean, it spread through Antigua, the USVI, St. Lucia, and the Starkey Foundation partnered with the WHO. And you know, WHO, when they want to do something, they do something
People know
big.
what that is.
So the World Health Organization, yes. And so when World Health Organization stepped in, because they're on such a larger global scale,
Yeah.
they deal with governments. When it's that big,
Yeah.
they're dealing with governments now, not smaller
Yeah.
foundation entities,
Right.
right? So, and that was great for us because we're like, okay, well, you're welcome. You know, we did something good. You know, we did something good. So they came along and they stepped in with Starkey, and now it's becoming this global effort, reaching all parts of the world, giving out free hearing aids. And I believe, and it's it started here on Nevis, and it started with the Caribbean Foundation for Children, and you know, it's again, I'm getting goosebumps thinking about it. Yes.
So part of that, and what the example is that it doesn't always have to be you can run the fastest to get to affect the world. You know, there's other ways of doing it. So part of it is leading by example, showing the younger generation that it's not just these, you know, options that you have. You can expand your horizons, and you can spread happiness and be successful doing so. There are rewards, not only monetary rewards, but emotional rewards that come along with it. And to show those options to the younger generation, I think is a big key of the success of this foundation, because now again, with the infection of knowledge, you now have to pass that knowledge around, and that's exactly what we're striving to do.
Thanks.
Yeah, that is some really good stuff. I'm impressed. So tell me a little bit, what is the Starkey Foundation? Because I'm not very I've heard it before, but I never looked into it. So tell me, what's the
Okay.
Starkey Foundation?
Starkey Foundation is, like I said, they're from Minnesota in the States, and it's a hearing aid foundation that goes around throughout the world, I believe to second and third world countries, and basically give out free hearing aids to those in need. Everything from children to adults. Yeah.
Yep.
And it's completely free. You when they were set up here, they worked with the ministry very closely, and you would a person would come, you get properly tested, and they'll pick out which hearing aid is best for you, set it up, fit it, everything, and good to go. Not a penny out of pocket. I mean, it really was life changing for everyone that they touched. Yeah.
And so I know you've been able to see the children show gratitude towards you and stuff, right? What about outside of the children? What about outside of the persons that benefited, children and parents? What about persons in general public? What has the feedback been from the Nevision public itself to what you guys are doing?
You want to touch? Well, it's nothing but positivity.
Good.
I tell you that.
Good.
There's been lots of reach outs from people who want to help, which is exactly what we're going for. That's what we want. We want more people to help, more people to just be involved. You don't have to. I'm not saying break out your checkbook, and you know, sometimes we need mentors. Sometimes we need people just to wear the shirt, hand out cards, hand out flyers, just talk about the foundation and what we can do and what we are doing. So it's again, I don't mean to keep using the same word, but it's very humbling when people stop you, and when people say, "Hey, I heard about the foundation, and how could I help?" You know, and that it really, that I'm like, oh, that's what we want. You know, when I hear that, I'm like, we're doing something right. So it's just, again, bringing the community together for the betterment of the community. You know.
Yeah. And so most of you, so it's you have a vice president and a president. So I'm assuming you have a full board, right?
Yes.
Are most of the individuals here, or you have a split here and in the States, etc.?
Split. It's split. Sorry. Go ahead.
Yeah. Being that it's a 501c and it's registered. Yes, they are. Basically, we have a establishment here to stay close to the communal needs of the island, but we also expand out because we need partnerships also. Starkey is in Minnesota. Right. So in order to be closer, to get those partnerships, in order to bring those resources here to the island, we need to be duly employed on both bases. Yeah.
Yeah.
Okay. So now, so you know about this beast COVID-19.
Oh boy. Yeah.
Rolls eyes.
Yes.
So has COVID-19 affected any of your plans in any way? Did you have anything that you were planning to do this year? Because I can even speak for myself, but 2020 was going to be my year. And it's not none of our years. So, right? Just slightly. So I'm saying, has that kind of dampened any of the plans that you had in any way, shape or form?
Yeah.
Well, yes. Currently, we do have things in plan, and they were supposed to be in fruition by now, or at least a little bit further on. Yeah. But because, of course, we're all dealing with the same thing. So things that were at a drip are now at a stop. Things that was a flow are now at a drip. So, but that being said, the positive side is that drips still fill buckets.
Yep.
So we are thinking positive about what we're doing, even though the pace has slowed down dramatically. We're still trekking ahead. You know what I'm saying? There is no stopping. You'll never get to your destiny if you just stand still. So we keep moving, and we're still plugging away at some of the projects that we have right now. There's a big project in order to bring some sustainability that we'll probably bring to your attention later on once things come a little bit more into light. But to bring some sustainability with employment and some other things to the island. So there's things in plan. There are things there, and hopefully moving forward, that the pace will pick up once the COVID-19 subsides. I mean, human beings, we've been here for a long time, so I'm sure this is another thing that we'll get over, right? So when so once we get to that level and we now at a level of normalcy back again, then I think that faucet would open up, the flow would come through, and now we'll get all the benefits of what we've been working on in behind the scenes so far.
Okay. So it's fair to say that you guys do have some stuff.
Oh, yes.
About to hit down, right?
Yes.
Okay.
As a matter of fact, those stuff would have probably been, had it not been for COVID, those things would have probably been already in the beginning phases or already established. Yeah. But because of it, there's been some delay, But it respected delay. We understand that we're all in it together. We share the sun. Right. So we share COVID too. Yeah. Right?
Oh, boy. Is there anything that I didn't ask or I didn't touch on that you kind of want to talk about, or just let the audience know?
I can plug our contact info for sure. For those who know me, know my face, you see me all over the island all the time. Feel free to just stop me and ask me anything. You could also check us out online, the Caribbean Foundation for Children.org. Phone number www.cfforc.org. That's the Caribbean Foundation for Children organization. Yes, and or give me a call 763-1457. But I just wanted to say again, just thank you to all of our partners. Locally here, we have many partners everywhere from Carib breweries to, oh gosh, what's the name? I just went blank.
It's all right.
Sorry.
We have so many support, major businesses, individuals, community leaders. So there's support all around, which is a good thing. What we need now is a little bit more exposure. So thank you right now for your time and giving us this opportunity to expose us, and give a positive light so people get to, see that they can come out and they can individually help. We do have support now, but the more the merrier. And the more support we get, the more then we can redistribute back out to the community. So this is basically investing in the Caribbean Foundation for Children is in self-investing into your community. And that's the thought, and that's the idea we're trying to push. Support us because we have shown that we can support, and we will continue to support you guys.
Thank you very much.
Well, this was a wonderful interview. I learned a lot as well, and I'm sure the viewers will learn a lot. And what you guys are doing, the Caribbean Foundation for Children, I must say, I'm going to speak on myself. On behalf of myself, you guys are doing a really good job. And what you're doing is going to be felt throughout the Federation, and I'm sure the wider spread. So thank you for what you're doing on behalf of everyone, even those persons that probably didn't get to thank you enough.
Yeah.
So thank you for that. You guys are doing good, and this is something that we need, and we need more of it.
Yes.
Right? Yeah. And I want to take this opportunity to wish you the best in your endeavors, even when the drip goes to a floor,
right.
A full floor. I hope it's done well, and I hope I'm here to see it so I could give support in whatever way I can. Okay? Absolutely. So I would like to thank you for that. Thank you for your information. Thank you for everything that you've done in terms of helping, and thank you for sharing the information with us. Right? So I am going to pledge to spread the word. As well, right?
That's all we need.
Right.
Spread the word.
Yes. So thank you. Thank you for viewing. This has been this week's edition of Health Matters. We spoke about the Caribbean Foundation for Children, CFC, and we were seated with the president and the vice president of the organization, Mr. Michael Henville, president, and
Jareem Encarnacion. If you know how to say carnation milk, just put an E in front of it.
That is easy now. Jareem Encarnacion. Love it. So yes, we have a mnemonic device. Yes. So I was here with Michael and Jareem, and it was a pleasure speaking with them. I learned a lot, and I would like you to continue paying attention to Health Matters and spread the word about the CFC. And if you can help in any way, please feel free to contact either Michael or Jareem, or just visit the website. Thank you for viewing. This has been this week's edition of Health Matters. I am your host, Shavani Nisbet, Senior Health Educator at the Health Promotion Unit. The fruit of the week is soursop. Soursop is a rich source of antioxidants that can help fight cancer. It's also really tasty and has loads of vitamin C. So have some soursop this week. Thank you.
Who's gonna love you like that? Taking care of yourself is a love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Nothing